out. So you see, I was self-conscious of having my sunglasses until I saw the governor with you. So I said, okay, it's safe. I can take on my glasses and put on the sunglasses and continue a little more comfortably in the sun. So I want to now welcome the members of the General Assembly that are here with us to say a few words. And we're going to start with an old friend, not only in age, but old in partnership, that I've met since my days at the Department of Health. So please, Rep. Diaz, join us.
Thank you, Director Mobise. Good morning, good morning. I need more excitement. This year is the amazing year for families and children in Rhode Island. It's due to the it's due to the General Assembly and the Governor McKee. So I'm so pleased to join you today, and I would like to call to the podium some of the members of the House who made it possible to accomplish so many great things this year. So I would like to call the co-chair of the Permanent Legislative Commission on Child Care, Senator DiMario, and State Representative Marianne Charles, please join us. Sky Slater, who is always a great advocate for children in Rhode Island since he was elected, and the amazing energetic Representative Baby Morales. Please join us. Governor, thank you so much, and distinguished guests. It's an honor to stand here today on behalf of the Speaker Shikarchi, a leader Blasijewski, and the entire House of Representatives to talk about the benefits and protections that we have enacted into this year's budget. I would like to recognize those members of the General Assembly who they had a very important role in this process. But I'd like to recognize the Permanent Legislative Child Care Commission members. I have so many here, including Genesis Center sitting in the commission, the Amazing Kids Count through Elizabeth Burke-Bryan, the Right to Start a campaign. I see so many members, and somebody who works so diligent in the commission who says, Leon Barrett. Where are you, Leon? And the Children's Cabinet, as the governor mentioned, it made all possible for us to be here today. There is nothing more important to me than young children. I have 5 kids and 6 grandkids, you can imagine. I have been advocating so long for quality child care and quality early learning that it has become a personal struggle for me. And I believe we have made great strides in improving the quality of child care and early learning in Rhode Island. But it was a long path, and Elizabeth Burke-Bryan, and everybody knows that. In 2018, I was gratified when the General Assembly passed legislation to establish a tiered child care reimbursement rate system to promote access to high-quality child care and to attract and retain more qualified and effective educators. A workforce that we believe is still severely underpaid for their expertise. Now, more and more stakeholders are showing a greater commitment to our youngest Rhode Island. And you know why? Because we have been advocating years and years and years. Lisa agreed with me that has been a hard work for many years. I am particularly grateful that the state budget at $3.6 million from federal funds for the Department of Human Services to increase payments to center-based child care providers across all groups. And at this point, I want to recognize and thank to DHS, who play an important role in this process, DCYF, and so many state agencies that work so hard along with the entire community to make possible we enjoy the moment the Governor McKee signed the budget. Also, the budget includes $42 million from state fiscal recovery funds, primarily to provide retention bonuses for direct care staff at child care centers and licensed family-based care providers. funds will also be used to waive any fees for new family care providers, including application fees and background checks. It would also be used for quality improvement, creating a workforce registry and education opportunity for direct care staff. In addition, plans are in the budget to expand the state's pre-kindergarten program by 5,000 seats, as it was mentioned by the governor. These actions show a commitment to early childhood from the whole General Assembly and the governor. We, all of us, feel that we are very closer to see the future when the children and family can enjoy early quality learning opportunity. What we're doing today is invest to the future. So thank you to my colleagues, thank you to you and to everybody who made possible to enjoy this moment. And thank you, Governor, for joining our team. Thank you so much.
So now, continuing with our partnership with the General Assembly, I want to, in fact, welcome my senator from Pawtucket, Senator Sandra Conover.
Thank you, Director. Buenos dias. I'm so excited for this day. As you can see, my little daughter is also very excited. It was important for me to bring her because it's about kids like her. And she started advocating with me since she was a little baby. So I know the members of the Right from the Start campaign really see her now and see, wow, like time flies. Also, I'd like to say thank you to Chairwoman Diaz for your energy, your partnership, your friendship, and your advocacy through all these years. It's been a pleasure to work with you to move this legislation forward. And it couldn't happen without the support of the legislators here. I know you did a great job recognizing everyone. So let's just give them a round of applause because this is a team effort. Senator Mario, come close to me. So Senator Mario, ever since she joined the legislation, it was very clear to me that she has in her heart the same priorities as me. She's a mother and her kids are here. Shout out to her kids. Hi. Thank you for being here with mom and supporting her in her work. And for us as mothers, this moment, it is very important to celebrate because we first mothers and then we are legislators and we understand what working families go through every single day. Right, Senator? A strong supporter start can make an incredible difference in the course of a child's life. That's why the investments being made through the children's budget are so important to our families and our future. President Ruggiero deserves so much credit for his support of this work, along with Leader McCaffrey, with Goodwin, and the rest of the Senate leadership. We are here because they listen to our concerns and they make sure that they prioritize those concerns and work collaboratively with the governor's office and all the directors to make sure that we're here today. So Governor, thank you so much for believing in our work and making it happen for Rhode Islanders and families and children. So thank you. Lieutenant Governor Matos, which is not able to be here today, thank you to her and also to my colleagues in the House, the Children's Cabinet, and all other legislators and advocates who made this children's budget possible. This year in the Senate, we made Rhode Island early childhood care and education system a top priority. As a chair of education, I am so pleased to know that many of our colleagues put in the priority agenda that this was what needed to get done. I'm so proud to work with Senator Gallo, Senator DiMario, and many others on our early childhood bills. Expanding access to pre-K was the centerpiece piece of our proposals because again and again, research has shown how valuable pre-K programs are for children and families. I'm grateful to say that the 2023 budget puts us on track to nearly double the number of free, high quality pre-K seats across our state, just like the governor and chairwoman has just stated as well. Pre-K helps children develop the cognitive, social, and emotional skills that will carry them through the rest of their lives. Expanding access to pre-K will help Rhode Island close achievements gaps, reduce poverty, and put our children on the path of success. I want to recognize Senator Gallo, who sponsored our pre-K legislation in the Senate, for her leadership on these issues for many, many years. Strengthening our state children's child care system was also a top priority. Child care is another critical component of children's development, and it provides a lifetime to working families. Didn't we realize that through this pandemic? I want to give a shout out to all the child care providers, home child care providers, and staff, early educators that really take care of our future. I'm certainly very grateful that my daughter gets to go to a place where she's scared, she learns, she thrives and grows. So I am here just to say they do so much work, and we need to continue being there for them. So let's give them a round of applause. I was proud to sponsor legislation to stabilize the early childhood workforce and to make child care more accessible and affordable to all families, especially those in communities that have left behind for far too long. I'm so grateful that this children's budget made substantial investments to achieve both of those goals. Our work on behalf of children and families didn't stop here. With Goodwin have led efforts to allow more low-income mothers to keep Medicare coverage for a year after giving birth. Thank you, Governor, again, for including that in the budget. And I was especially proud to help lead our Cover All Kids campaign. Red Morales, it was a really good ride to get here. I want to particularly give a shout out to then Director Chafee that talked to the governor about making sure that he preserve and include this line item in the budget. Governor, you don't understand what this will impact. This investment will impact children to have access to health care regardless of their immigration status. But also, I think it's so important that you recognize that these kids goes to our same public school districts, and this is for every children in Rhode Island. There are many more initiatives that we have undertaken together, and it is great to have leadership like yours that really understands that it's for all families in Rhode Island. The work doesn't stop here. On behalf of my colleagues in the Senate, I want to express our continued commitment to Rhode Island children and families. Just like Chairwoman said, this is an investment for the future. I want to give a last shout out to the parents. Without the parents' advocacy, I think the stories, the testimonies, like all the hours of coming to say house to tell us how important it was for them to be heard, I think we wouldn't be here. So all working families in Rhode Island, this is for you. Thank you so much, and let's continue investing in children and families. Thank you.
Thank you, Senator Sandra DeCano, my representative in Pawtucket. I'm so proud to see that. So we all heard from Governor McKee, from the General Assembly leadership, how historic this moment is. But I look back, and I've been here since 1995, and I do not recall one single budget year that made the kind of investments that we are seeing this year. So it is truly a historic moment. Governor, General Assembly, and community partners, we are all to be thanked, because this could not be done without that partnership. I see so many of you that have been in the trenches, asking, demanding, requesting, and it's necessary. And it takes time, but it also means that we need to stay committed to continue with these investments in the future. While this is an historic moment, it cannot stop here. And I know people will say, but we need to continue to think in the future and how we maintain all of these critical investments. I think about when I came to the United States many, many years ago, and the opportunities that this budget creates, the pathways that it's open for families are tremendous. The having, as so many people talked about, the possibility of, regardless of your immigration status, to have access to care. The possibility that what creates for pregnant women when it allows an extension of their postpartum coverage. The investment that is making in our early childhood healthcare workforce, on our direct care providers, which is our CNAs, which are majority women and women of color. It's an equity issue that we are seeing addressed. At UHHS, we have like 3 guiding principles that we've been following. We talk about voice, choice, and equity. Voice, because we want to make sure that every individual, every family, every community voice, it's elevated. It's heard, it's respected, it's honored. And that should lead to creating choice, meaning that the programs, the investments we made are guided by that voice and create the opportunity for people to really have choices. We saw the investments in childcare. It will give people the choice, if they choose to do so, to be able to go and have their children in a childcare setting where staff is fairly paid. And then equity. As I said at the beginning, the investments allow us to truly create a system, a community, a state, where every child, where every individual has the opportunity to achieve their potential, regardless of their accent, like mine, regardless of the color of their skin, regardless of where they were born, their disability status, their gender identity. Every single one of us will have an opportunity to achieve our potential. So that is indeed amazing and historical, and so thank you. Now, the work doesn't end here. This is just the beginning, as we said. At UHHS, we've been planning for the past year on focusing on behavioral health. I'm a psychologist at heart and by education, and a mental health professional, so issues of behavioral health and mental health have always been at the core of what I've done. And we've planned with a team, cross-agency support, community-involved providers, to what kind of behavioral health system do we need in the state. What we have now is the opportunity to implement. And so with our director colleagues at DCYF, at BHDDH, with the support for labor and training and higher education, we're going to build a system with DHS and Human Services. We're going to build a comprehensive, integrated system of health and human services that truly serve families. We're going to have the support for Director Thorson and the Department of Administration, making sure that we can spend timely all of this funding that we are being given. And so we look forward to now move towards implementation. Our system of care for children, we're going to start moving forward with our single point of access, so important with 988 implementation. We're going to be able to implement, and we are ready to have a procurement, in fact, for our mobile crisis unit. So once you call, to make sure that you have a response that is immediate, that is timely. That is happening as we speak. We're going to be expanding the array of services that DCYF offers, not just for DCYF children, but for all children. We're going to be able to expand the care management that DCYF offers, again, not just for DCYF children, but for all children. These investments don't end on youth and on children. We are also investing in behavioral health with the adult population across the lifespan, by creating and building on our comprehensive community health center, behavioral health centers. And we are doing that, again, partnering with every single one of you, making sure that your voice is heard, making sure that we create a choice for everyone that we serve, and making sure that we keep equity at the core and front of what we do. Now, we have investments in education, we have investments in housing, we have investments in our workforce. All of these is necessary for these to become a reality. if we don't invest in our workforce, if we don't invest in educating our young children from the get-go, if we don't invest in continuing to train our current workforce for the future and what we can bring, we will not achieve this dream of equity for all. But with everyone's commitment, with the staying power that I know everyone in this, not room, but in this backyard, hot, but wonderful to see everyone here under the sun, with the staying power and commitment of every single one of you, community partners, family, cabinet members, General Assembly, and definitely our governor, we will, in Rhode Island, definitely achieve equity for all. So thank you for being here, for continuing to be here, and for committing to stay engaged with a focus to the Children's Cabinet on children's and across what we need to do, but with, in general, a commitment to Rhode Island. So thank you. And so before I finish, we have one more, and I'm not sure where she is at, but we are going to be hearing, I hope, one of our more incredible state early educators, Adri Mijares, which is she's an administrative associate here at the Genesis Center, and she's going to share a few words with us.
Hi everyone. Thank you to the Governor Daniel McKee, senators, members of the House, and special guests for visiting Genesis Center as such a special day. My name is Adri Mijares. I am Venezuelan by birth, and last year I proudly became a citizen of the United States of America. This beautiful country has given me many opportunities to grow as a person. At the same time, I feel that I give positive things to this country as well. One of the things that I had to do when I arrived to this country was learn English as a second language. I'm still in the learning process. I'm very grateful to belong to the Genesis Early Learning Center, since the children make me happy and inject positive emotions into my heart daily. We worked at Genesis ESC in person during the pandemic, which was challenging for everyone, especially at the beginning of the pandemic. But you know what? We did it. And we'll probably serve our beautiful families. One item I feel is essential to highlight is the support from the State of Rhode Island and the Department of Human Services with the 2 educator retention bonus. And with my colleagues to our service and education, I plan to use this money to further my education and the health and welfare of my family, who I love and honor for allowing me the confidence to speak to you all today. Currently, I am enrolled in the TEACH program, which has taught me how to work with children in the early stages of life. Children from birth to age 5, the first years of child's life are crucial for the brain development. I believe that we must give all children the best loving care, support, and experiences to become successful through their lives. We are all responsible for creating a community and a country where humans practice the qualities we taught in their lives early years. Please remember that we are all key players, such as parents, teachers, and others, who positively impact our children's upbringing. Every grain of sand we contribute will be precious and will be appreciated. Thank you very much. And now I'm going to introduce to another special coworker, Cindy Alvarado.
Good morning, everyone. My name is Cindy Alvarado, and I also working at the Genesis Center, but I'm also a mother of one of the children that attended the Early Learning Center. And I want to share my story, my experience as a parent and also as an employee here at the Genesis Center. If I wanted to share everything, it may take hours, but I'm gonna be brief, and I'm gonna tell you, I'm gonna highlight the most greatest experience. I'm a little nervous, so I'm sorry. So I came to the Genesis Center back in 2013 as a volunteer. I was enrolled in college at CCRI as an ESO student, and after 2 years, after I finished my ESO programs, I enrolled in an associate program. And after 2 years attending class, I had 3 kids. Back then it was very hard. It was a struggle because I had to go to the factory, go to school, pick up my kids, go to school. It was really hard. But then in 2013, I decided that I needed to get experience in in an office environment, in a place that I was going to be able to learn and apply my skills. So I got in contact with Tyler. She used to work here, and I said, I'm just want to become a volunteer and get the experience so I can apply later on in another job, entry level or anything better than what I have. And she called me the next day and she goes, come in, we can talk about what is suitable for you and you can start here. And I came the next day. I was nervous, I was excited, but I was given the opportunity to volunteer Mondays and Friday. I took it as a job. I was here every Monday at 12, every Friday at 12 to 5 o'clock. I want to share this because this is very funny. I was sharing with others. The first time that I came, they put me in a cubicle and I took a picture of that cubicle and I sent it to my husband and I said, this is going to be my job. I declare that the first day that I came. It took a few months. I was getting impatient, but I never mentioned it. But in July, I was offered a position as an enrollment assistant. And that was the beginning of a lot of great things that were yet to come. So I've been here for 9 years now. Throughout my 9 years, I've been in different positions. Genesis Center has allowed me to work around my schedule, not to only finish my associate, also my bachelor's degree at Rhode. And last year I enrolled at URI to complete my master's. So not only that, right now, I get emotional sometimes because I want to tell members of the House, senators, governor, the investment and the decisions that you guys made at the state level, it's not in vain. I was one of those numbered young mother, what she's gonna do, but I came to this center and I was given the opportunity to grow and to move forward with my education. In 2016, I had a baby. And I was worried. I was like, what am I going to do now? How am I going to go to school? Huh? So I was also given the opportunity to bring my son here to the early center, to the child care. So he started at 12 weeks coming to the Genesis Center's child care. And he was here to last year when he started kindergarten. So he participated in the state pre-K program. And when he started kindergarten, I was called to the first parent conference meeting where you discuss how, the children's progress. The teacher told me, it's amazing. He's already at 40% out of 100% of his curriculum. He was ahead of many other kids. And I had to give credit to those teachers here. And I want to mention some of them because I don't remember all the names. I'm going to say Jocasta. She was the infant teacher. She took care of him, not like another children. She was loving and caring, also professional. Maria, she's no longer here, but she was great. I remember one day walking in the room and she was sitting, singing a song and going through a book with my son, and my son was so happy. I still have the video. Jody, when he started the pre-K, how patient they were with him. Every afternoon when I would come to pick him up, they would share stories with me. Every time he would learn something new, he would share with me. So this is a great program, and as a mother and also as an employee here, I have to tell you it's not in vain. Thank you for the support. Thank you for what you're doing. And the way this kind of investment in programs impacted my life, and not only my life, my children's and my husband, because my husband came here, became a U.S. citizen as well. My son participated in a program here. So it affects positively the entire family. So the way it did in my case, it will in many, many families. So thank you for your support. Thank you for everything. Thank you, Regina, the director of the child care, all the teachers. Thank you to all my supervisors from Sherilyn to Shannon, Lady, everybody are great here. Thank you.
Thank you, Cindy, for sharing your story, and I cannot think of a better way to end the meeting than with your story. It exemplifies everything that we are supposed to be working for. So thank you. I appreciate you. I see you and your family. And I want to thank the governor for being here, members of the General Assembly, my colleagues in the Children's Cabinet, the community stakeholders that are here, parents, the children. I want to thank everyone for here, and this concludes our meeting for today. Thank you.